Hello everyone, my name is Nelson Morales and I'm happy to present part of my doctoral research at Western University on the ethical principles for the use of artificial intelligence within the World Anti-Doping Program. First, I would like to provide a general description of the realities that justifies my research. Despite progress in prevention, detection, and cooperation, doping remains an ongoing issue in sport because it requires ADOs or anti-doping organizations to continuously improve their effectiveness to maintain legitimacy and the integrity of sport. And that demands ongoing innovation. So the integration of AI aims to provide more efficient and cost-effective responses to doping. So AI can significantly improve the analysis of vast amounts of biological data and optimize testing efforts, allowing the detection of complex doping patterns. So the goal of these AI initiatives is oriented to make anti-doping more effective. But here is the problem. While research and innovation is spending a lot of time and resources on what technology can do, we are not investing the same resources on the ethics. The conversation about what the technology should do. So my main thesis is that we need to set the ethical principles before AI is fully developed and implemented in anti-doping. Even though these technologies are not fully visible in the sector yet, we can see some indicators that may play a significant role in anti-doping. On the research side, there is some funding flowing about new detection methods. We have the example of AI technologies to analyze athletes' performance passport in certain sports for certain genders. We have AI technologies to improve the detection of blood doping in sports. Or the example of AI technologies based on voice analytics to detect the risk of doping behaviors. On the policy side, WADA has also included artificial intelligence in their strategic plan not only to gain internal efficiency, but also to improve the effectiveness of the whole system. Also on the policy side, it's interesting to look at the upcoming 2027 World Anti-Doping Code, because this update introduces a significant shift in the definition of a contaminated source for athletes and athlete support personnel, potentially linking an athlete's due diligence to the accessibility of information through reasonable artificial intelligence search. In practical terms, we are acknowledging as a system that AI search is part of the decision-making process of the athlete or any individual involved in the anti-doping ecosystem. So we need to make sure these AI technologies are not just fast, efficient, and accessible, but that they are fair and accurate. So in the next part, I will dive into why chatting with an AI technology about anti-doping may be riskier than just doing a Google search, but also about potential advantages of these developments. So this redefinition is a good trigger for our general discussion. These developments also raise pressing concerns about data privacy, algorithmic transparency, and the appropriate balance between technological efficiency and limits to human surveillance. So this thesis seeks to explore cases of potential AI applications in anti-doping and develop an ethical framework to guide the responsible use of AI within the World Anti-Doping Program. So I'm basically focused on three main questions. First, what constitutes a comprehensive definition of AI that addresses its role and challenges in the framework of the World Anti-Doping Program in a way that it ensures clarity and consistency in the application and regulation. Second, what are the ethical implications of implementing AI technologies within the World Anti-Doping Program? And third, what general principles should be included in an ethical framework to guide the use of AI in anti-doping? So the ultimate purpose is to propose general principles that help to develop an ethical framework for AI in anti-doping. To support my research, the thesis takes a multidisciplinary approach, mainly grounded in philosophical analysis and normative reasoning. So the analysis includes the idea of anticipatory governance, which helps shape an ethical framework that proactively addresses the changing risk and challenges posed by disruptive technologies. The intersection of these three concepts, ethics, World Anti-Doping Program, and artificial intelligence, um, lies in the ethical application of AI within the program. So the central challenge is to ensure that AI enhances the effectiveness of anti-doping efforts and respects athletes' rights by upholding fundamental values of sport. So the theoretical foundation draw upon the ontology to emphasize universal duties and athletes' rights, complemented by the ethics of care to consider relational aspects and vulnerabilities. These ethical traditions, the ontology and the ethics of care, are then extended through the practical lens of bioethics, which guides the ethical assessment of technology in light of fundamental principles in medical sciences. And finally, I focus on AI ethics and the principles of fairness, transparency, accountability in algorithmic decision making, always under the lens of anticipatory governance as a response to the problem of disruptive technologies in the field of application. Then the methodology that I follow, it's a documentary research approach that involves identifying, selecting, and organizing primary and secondary sources. And they include philosophical papers, technical and normative documents, academic articles, and institutional statements that then are analyzed critically. The use of AI in anti-doping remains at a very early stage. So with only a few pilot projects and research studies exploring the potential of AI. So to understand the risk, I'm looking at three specific cases. First, the ethics of using voice analysis technologies in anti-doping. Second, the ethics of applying machine learning to monitor biomarkers in athletes. And third, the ethics of large language models as sources of anti-doping information for athletes and athlete support personnel. So these three cases cover core elements of what an anti-doping organization does: intelligence and investigation, testing and education, and result management. But because each technology works differently and they have diverse purposes, they each bring their own set of ethical red flags. One challenge I face in this research is that AI hasn't been fully deployed in anti-doping yet, so I'm looking at domains where AI is already being used, for example, law enforcement, healthcare, digital public services, and education so we can learn from their mistakes and ethical flaws. So, for example, if an AI in public health has issues with bias or privacy, we can bet those same issues will show up in anti doping if we are not ethically oriented. So, to illustrate the problem of the ethics of using AI in anti doping, I will talk today about two specific examples. I'm conscious about the time, so I will use only two cases. The first is the ethics of using AI voice analysis in anti-doping. So this technology consists of short and structured telephone interviews to athletes and officials, expecting that they answer a series of closed questions on doping. So this technology is designed to detect speech patterns, looking for indicators of stress, cognitive load, or evasive responses from individuals. The tool doesn't aim to provide definitive evidence of an anti-doping rule violation, but to generate risk indicators that may inform intelligence-led decision making from anti-doping authorities. Based on a preliminary analysis of this case, we can identify some initial and very evident risks of harm to the people involved. The first one is respect for the person, respect for athletes, and the implication of treating athletes and individuals in sport as sources of subconscious data. Second, there is a risk of harm. It's clear that we need to assess the professional and psychological impact of false positives. Under the principle of justice and equity, we need to ask ourselves how this AI decision making process affects different athletes' population, and that we guarantee that institutional transparency is a general principle. Based on the ethics of care approach, we need to ask ourselves if we are indeed reducing the burden of invasive physical testing for the clean athlete population. And finally, that we balance the intrusion and integrity, that we rightly find the threshold for ethically justifiable surveillance to the athlete population. The second case that potentially will inform the ethical framework that I'm looking to develop is the ethics of using large language models as sources of anti-doping information for athlete and athlete support personnel. So let's look at the upcoming 2027 World Anti-Doping Code. I already mentioned the fact that this update introduced a significant shift in the definition of a contaminated source. So we, as part of the anti-doping ecosystem, we are expecting from athletes to use artificial intelligence to research and search on anti-doping and doping. So we need to make sure that these AI systems aren't just fast, efficient, and accessible, but that they are fair and accurate. So this redefinition is a good trigger for my discussion. So to understand the risk, we must first look at what a large language model is, because an LLM is a prediction tool based on probabilities. So it breaks text into chunks of characters, studies sentences to learn language rules and human communication, and finally it predicts what word should come next and mimic the way we communicate. So when an athlete asks an AI if a specific supplement is safe, the model doesn't really understand about the supplement or the prohibited list in the way a human expert does. But through a prediction, it determines what an expert would say or what is established in the rules based on the information available. So, understanding the way these technologies work is important to identify ethical risks and what could be the responses from a policy perspective. To understand where we are going with AI, we first need to look how the search of anti-doping information has evolved. For years, athletes and support personnel relied on direct normative and informative sources: the code, the prohibited list, brochures from ADOs. Then came the internet came, which fundamentally changed the landscape. So the information became much more accessible. However, when an athlete searches for information, search engines typically redirect them to official anti-doping organization websites or specialized tools like Adele or Global Drug. So to facilitate accessibility and consistency, WADA and the whole system worked on education and compliance strategies that made messages consistent across ADO websites. But now we are moving from a system of searching information to a system of generating information. So we expect a single and personalized response generated by an algorithm. So this evolution has made information more accessible than ever before, but it may be removing the safety net of official sources. And this is the leap that needs the ethical inquiry we are discussing today. The fact that athletes, coaches, and doctors could be viewing rules, science, information, and even values through the lens of AI. And of course, this may be followed by risks and opportunities. So it's important to reinforce the message that AI predicts language, but it doesn't reason. And this is not inherently negative or harmful, but the challenge is to find a balance, avoiding the negativity bias towards artificial intelligence and technology in general that rejects opportunities of innovation while promoting critical thinking toward AI risks. And they include the loss of autonomy and responsibility, the fact that the goal of anti-doping education has been to empower and equip athletes to make responsible, autonomous, and informed decisions. And as AI becomes an unavoidable part of our life, we must embrace that interactions with AI is a widespread behavior in the decision-making process of an athlete, a coach, of a sport doctor. However, it's important to preserve the agency of the athlete, and this means assuring that accurate and consistent information remains the base of the system. So, strategies to engage critically with AI regarding anti doping can turn a potential risk into a method for exercising due diligence under the strict liability principle. Then there is certainly a risk of cognitive dependency. So, over relying on AI can weaken our own judgment and understanding of the rules and reality. And if these interactions are not approached with critical mindset, we risk cognitive dependency on technologies. And this is not just about poor learning, but in anti-doping could translate into poor ethical engagement if these interactions with AI are not meaningful. Third, we have the risk of acceptable errors in anti-doping. We need to recognize that the margin for these acceptable errors in anti-doping are minor. So in other domains, a mistake, an error from artificial intelligence is just a wrong recommendation about a restaurant or an skincare product. But in anti-doping, an AI error can lead to a career-ending anti-doping rule violation, or reputational damage, or severe health risk. Finally, I would like to point out to the potential risk of inconsistency and people and the tendency of AI to people pleasing. So these chatbots are designed to be helpful and to adapt to the user's input. So if an athlete asks a question in a way that seeks a specific safe answer, the AI may align its response with the user's expectations rather than objective or scientific truth. So these ambiguities may be the opposite of what a regulatory and scientific oriented system like anti-doping needs. Well, I have spent time discussing the risk. It is essential to acknowledge that AI chatbots offer opportunities for the anti-doping and sport communities. So the most clear benefit is the simplified and amplified access to information. Historically, anti-doping regulations have been criticized for being dense, legalistic, scientific, and difficult to navigate for an average person. So AI could act as a linguistic bridge with anti-doping. The second major potential advantage is uh, the contextual customization. So this conflict with consistency, the one that we need for anti-doping information, but traditional education often suffers from being one size fits all. So let's think about a marathon runner, a weightlifter, and a team sport athlete. They all have different risks and requirements, yet they often receive the same anti-doping information without addressing specific realities and needs. So AI chatbots may tailor information to the specific context of the user, either if it's about the role, the situational context, or some linguistic and cultural barriers that may be overcome with the use of AI. So when used correctly, this customization doesn't just deliver information, but it delivers relevant information to the athlete. So following this model as a community of practice and researchers, we may begin assessing AI tools specifically against the World Anti-Doping Agency international standards for education. For example, by testing these chatbots on mandatory topics in the international standards. When it comes to anti-doping rule violations, we could think about the misinterpretation of the rules of or information based on outdated rules. When it comes to consequences of doping, an AI technology could provide distorted risk perception with an impact on decision making from the athletes. Regarding principles and values associated with clean sport, we need to reflect if in this interaction with AI technologies there is a genuine space for moral engagement and ethical reflection. Can we truly discuss clean sport values and spirit of sport based on ideas generated by a predictive model of human language? And finally, the use of medication and therapeutic use exception and the risk of providing wrong medical advice, which is a clear risk not only from a sporting perspective, but from a public health perspective. Finally, I would like to highlight that the expected outcome of my thesis is that the two cases presented today, the ethics of using AI voice analysis and the ethics of large language models, together with the ethics of applying machine learning to monitor biomarkers, inform an ethical framework that help anti-doping organizations to implement artificial intelligence in a responsible and ethical manner. I hope you enjoyed this presentation and you are having a good time in Napoli. Thank you very much.